We begin in the United States, where record numbers of jobless workers are facing uncertainty as they wait for Congress to decide on whether they'll extend a boost to unemployment benefits. The current coronavirus relief program expires at the end of July. But Republicans in the Senate are divided over how much financial aid they're willing to provide. All right, let's get more from Washington, D.C. And for that, I'm joined by DW's Oliver Salet. Hello to you, Oliver. So what exactly are the lawmakers unable to agree on? What are the sticking points?
Well, we are looking right now at a conflict essentially between lawmakers, Republican lawmakers at Congress and the White House. And the White House wanting to cut unemployment benefits to around $100 per week. Currently, they're at a level of $600, but they are running out, as we've just learned in the report. Now, the White House believes that the current higher level of $600 is a disincentive for American workers to returning to work. Republicans at Congress do believe that a higher level is necessary to protect the workers. And of course, now with that ongoing spat, they have proposed a new proposal that's supposed to be unveiled as soon as Monday after the weekend. That again then has to be confirmed by the Democrats as well as by the White House before that. So we are looking at some more negotiations in the coming days ahead.
All right, so some difficult negotiations. And Oliver, what happens if they don't manage to agree?
Well, if they don't, then that would certainly mean lots of negative. It would have lots of negative implications for the recipients of that money. They could potentially run into default, not pay their rents anymore, and that eventually might even develop into a full-blown financial crisis, with banks running into default when they don't receive their credit installments anymore. The stock market could crash. Of course, very dramatic pictures. We would see lots of suffering among Americans. And that would certainly also mean poison for President Trump's attempts to turn the tide politically, as he's currently losing support as a result of his handling of the coronavirus pandemic. So certainly one thing that President Trump does not want to have that situation. Also, the Democrats don't want to be held accountable for a situation like that. So both parties are actually interested in finding a deal. And it's also worth pointing out that historically, no matter how difficult the negotiations have been, that a deal has always been found. So we can be carefully optimistic that this will also be the case this time around.
All right, so a lot at stake. Oliver Salet in Washington, thank you so much. Almost 285,000 new cases of coronavirus infection were recorded globally in the past 24 hours. That's the highest number in a single day so far. The World Health Organization says tighter restrictions may be needed to curb the spread in Europe. With many people traveling for summer holidays, some European nations are introducing new measures to protect people from infection.
Vacation season is in full swing, and authorities across Europe are trying to stop a second wave of infections. Belgium is just one of the countries that have tightened the rules on masks. This after a 3-year-old became the youngest person to die with the virus in the country. A local governor appealed to the public. Many doctors keep telling me it's getting out of control, so we are asking people to be even more cautious than they have to be. In Catalonia in northeastern Spain, nightclubs and entertainment venues have been ordered to close after a surge in cases. France has advised its citizens to avoid traveling to the region. Asia is also experiencing a resurgence in infections. Vietnam reported its first locally transmitted case in nearly 100 days. Japan and South Korea have re-implemented restrictions. The World Health Organization has warned people everywhere to remain vigilant.
We're asking everyone to treat the decisions about where they go, what they do, and who they meet with as life and death decisions, because they are.
But social distancing isn't always possible. Thousands of people are stranded in a baseball stadium in the Philippines. This after a plan to transport people back to their hometowns from the capital, Manila, drew larger numbers than expected. A survey released Saturday shows that support for the handling of the pandemic by national governments is falling in many countries.
North Korea has placed the city of Kaesong, near the border with South Korea, under total lockdown after a person was found suspected of COVID-19 symptoms. Leader Kim Jong-Un called an emergency meeting on Saturday. If confirmed, it would be the country's first official case. North Korean state media say the person suspected of having the virus crossed illegally from South Korea. For more on that story, I'm now joined by Josh Smith. He's a Reuters correspondent in Seoul in South Korea. Josh, if confirmed, this would be the first case officially acknowledged by North Korean authorities. How credible is that?
There has been a lot of suspicion cast on North Korea's claims to have no confirmed cases so far, not the least because information is so difficult to get out of North Korea in any kind of independent fashion. Obviously, there's a lot of control on any kind of media access, and even international institutions like the WHO have only had to rely on numbers given to them by the North Korean government. And so while it's been a lot of suspicions that there is some kind of outbreak there, we also have no confirmation that there has been any kind of outbreak. And in recent weeks, North Korea had actually shown signs of lifting some of the restrictions that it imposed there. And so at this point, it is really unclear. And as you said, this would be the first confirmation. And so that's something that's going to get a lot of attention if confirmed.
This case has been linked to a person whom the authorities in North Korea claim defected to South Korea 3 years ago and just now returned to North Korea. What are we to make of that?
It is a somewhat interesting scenario on several levels. South Korean authorities here say that they're still figuring out whether that story is credible, but they have said there's actually a good chance that someone did indeed return to North Korea recently. At the same time, it's unclear whether that person actually had COVID of any type. And so it's something that we may never know the actual details of that. In the past, North Korea has sometimes mixed a bit of facts and fiction together, and that may be the case that we're looking at here.
Josh Smith in Seoul, thank you.
Britain has imposed a 2-week quarantine on travelers arriving from Spain after a surge in COVID-19 cases there. Europe had only recently reopened most of its borders to travel. Nightlife in the Spanish region of Catalonia is shutting down once more, while national authorities are introducing measures against the recent spike in infections. The new restrictions are causing renewed disruption to the travel industry and to tourists.
The UK's sudden decision to take Spain off a safe travel list left travellers with no time to prepare for its consequences. Tourists returning home via Madrid's Barajas airport were frustrated. They had come on holiday with the understanding they would not have to quarantine upon their return.
I think it's really bad because it's just come all of a sudden. It's not given people much time to prepare, so everyone's now panicking. And I think it ruins plans for everybody. We had a wedding to go to, and we had plans to, visit friends and family who we haven't seen in a very long time, and now we're going to have to cancel all those plans. So it's really quite upsetting, yeah.
Those with holidays booked for the coming days and weeks also face headaches. Tour operator TUI says it has cancelled its upcoming flights from Britain to Spain. But some airlines say they'll still fly, possibly leaving would-be holidaymakers out of pocket. Spanish officials insist their country is safe, with outbreaks being local, isolated and controlled. But Britain's Foreign Secretary Dominic Raab said the UK had had no choice but to swiftly respond to the emerging data.
It showed a big jump right across mainland Spain. That was then assessed yesterday afternoon, and we took the decision as swiftly as we could. Otherwise, we risk reinfection into the UK, potentially a second wave here, and then another lockdown.
In Barcelona, nightlife is scaling back once more, with clubs forced to close and a reimposed curfew on restaurants and bars. There are concerns young people could transmit the virus to the elderly. France is also advising its citizens against crossing the border into neighbouring Spain, prompting concerns over tourism there. Fears of a second wave of COVID-19 across Europe are seeing nations struggling to stave off fresh outbreaks while trying to reopen their economies.
For more now, let's go to journalist Richard Fitzpatrick in Barcelona. Richard, greetings. Help us sort out some contradictions here. The UK's Foreign Secretary says there has been a big jump in cases all over the country. Meanwhile, the Spanish government insists the outbreaks are localized and under control. What's closer to the truth?
You'd have to say the British are closer to the truth. The statistics are telling there's been a triple-fold increase in infections over the last 2 weeks. At the moment, there's over 200 clusters all over the country, local outbreaks that the health services are battling with. They're in all the corners of Spain, up in Galicia in the northwest, in Catalonia and Aragon in the north east, and down in Andalusia as well. There's a notorious case in a nightclub there in Cordoba where 91 people were infected in a nightclub of 400 people, where less than 200 people should have been in that nightclub. We know pretty much the causes of these outbreaks, the problem with tourism, the problem with seasonal workers migrating around the country, living in cramped conditions. But the big problem is the lack of contact tracing. So the authorities don't have a handle on the infections and the people, secondary people who could be infected.
You know, as you surely know, Spain was hit hardest by the coronavirus in Europe and just opened a month ago after a strict lockdown. How big are fears now of truly a second wave in the country?
Yeah, it's funny. There's a bit of kind of a lack of reality about the situation. It's the middle of the summer here. People are trying to make the most after a pretty severe lockdown for the guts of 2 months. So they're going about their holidays, going to their summer homes, going to the beaches. Although I live in Barcelona, a lot of the beaches in the city were closed at the weekend. But at the same time, people realise that we are very close. As the government says, we're only one step away from returning to a state of emergency. So it's very troubling. But after 4 months of this pandemic, there is an element of fatigue. So just have to wait and see what happens.
Richard Fitzpatrick, really appreciate that.
Thanks.
Australia's state of Victoria has recorded its highest daily death toll from the coronavirus. 10 people died within 24 hours. This despite a 2-week lockdown imposed in the state's largest city, Melbourne. The state leader says the outbreaks are due to workplace infections. Thousands of Israelis have held protests across the country calling for Prime Minister Benjamin Netanyahu to resign. The largest rally took place outside Netanyahu's home in Jerusalem. The protests have been going on for several weeks now, sparked by anger over the government's handling of the coronavirus crisis and corruption charges against Netanyahu. A small research lab in southwestern Nigeria is working hard to develop new solutions to tackle the coronavirus and prepare to battle future epidemics. It could soon turn into one of Africa's largest genomic research centers. Its founder supports young African scientists and wants to strengthen local research. His efforts are already paying off. Have a look.
Ebola, Lassa fever, and now the coronavirus. This research lab in Edo, southwestern Nigeria, has been at the forefront in the fight against killer diseases. These scientists were the first to establish the genetic profile of the new coronavirus in Africa, when the first case showed up in Lagos. The force behind this place is Professor Christian Happy. Raised in Cameroon, he studied molecular biology at Harvard. Then he returned to Africa to set up a lab. This year, every mind at his research centre has been focused on COVID-19. We sequenced the first COVID-19 virus in Africa in this lab in 48 hours. That wasn't possible before, neither in China nor in Europe. No laboratory has hit this record before. The centre was opened in 2016. Around 1,000 scientists, mostly from Nigeria and West Africa, have passed through its doors. Professor Happy trains them as top researchers in biochemistry and genomics. His aim? To catapult young African scientists to the top of scientific research. He wants to develop affordable solutions for tackling infectious diseases in Africa and in the rest of the world.
Understanding the genetic makeup of an organism is like trying to understand what the organism is all about. If you understand that, then you can know the direct approach on how to tackle the organism.
Happy's team has already set down another marker in the battle against the coronavirus. They've devised a fast-track test that costs less than €3. By the end of the year, the lab will have moved to a larger building. It's set to become the biggest genomic research centre in Africa. And with an ongoing pandemic, the world is counting on it.